Problem list. The items listed in this section reflect a range of conditions or treatments from your doctor's medical record that are most closely related to one or more of the 4 conditions targeted in this project: diabetes, COPD, CHF, and hypertension. Care plans. The myHEALTHPlan Unified Care Plan is a plan that's created by your family doctor. It is a collection of interventions or scheduled actions that your doctor has recommended to assist you in managing your health. You can choose between viewing all of your care plan interventions or just the ones that are still due. Click in the circle next to either Still Due or All Interventions. All interventions include completed, still due, and overdue interventions. Once you have selected how to view your care plan, click Display. View Access Logs. Logs show you when you and your healthcare providers, for example your doctor's office and the allied health professionals at the White Rock Chronic Care Center, or if the myHEALTHPlan Help Desk staff have accessed your information on the myHEALTHPlan web portal. Please note that anyone accessing your information is bound by the highest standards of security and protection of personal privacy. To view the log, choose the desired date range by typing in the date fields or clicking on the calendar, the little blue box next to the date field. You can then sort either by date or by person using the drop-down menu next to Sort By. Once you have entered a date range and sort criteria, click Display. Depending on the search criteria, the log may be more than one page. To navigate through each page, use the numbers in blue at the bottom left of the list. Clinical outcomes. Achieving your targets for specific observations, otherwise known as measurements, is an objective way of measuring your health and monitoring your health changes over time. The clinical outcomes screen is where you can view a table or a graph of your clinical observations, for example, blood pressure or weight. You can select the measurement and the date range you wish to view, and then click Display. To see a complete list of your measurements, click on the drop-down menu next to Observation. These values all come from your doctor's medical chart. Select the time frame for the measures you wish to view using the field and drop-down menu next to Show Last. Select to view measurements either as a graph or a table by using the drop-down menu next to Show As. If you wish to see values on the graph, make sure you tick the box next to Show Values. Once you have selected your criteria, click Display to view your table or graph of your chosen clinical outcomes. Wherever you change a parameter, you must click Display for the screen to update. Investigations. Investigations are items such as laboratory tests. Most test results or investigations require clinical training to interpret. Also, the meaning of them depends on the total clinical picture. Use the drop-down menu next to View the Last to choose the time frame of the results you wish to view. You can then group your results by date or by type of results by using the drop-down menu next to Group By. Once you have selected your criteria, click Display. To view the results for a particular date, click on the blue heading associated with that date. Usual medications. Usual medications are your usual medications that are documented by your family doctor in your chart. Overview report. To print a copy of all of your health information from myHEALTHPlan, click on Report in the menu on the left-hand side, and then click Create Report. This will generate a document with all of your health information that is on myHEALTHPlan. You can then save it or print it. If you cannot view this report, please contact the myHEALTHPlan help desk at 604-306-5821 on weekdays between 8:30 a.m. and 4:30 p.m. Library navigation. To view the reference library, click on Reference Library in the menu on the left-hand side of the screen. Click on the link to be directed to a new window containing the reference library. All the resources are displayed. You can filter the resources by category using the drop-down menu next to Display. You can review all resources or just the recently updated or added resources. For all resources, ensure All is typed into the box, added or updated in the last so many days. Enter a specific number of days to view all resources that were added or updated in that time frame. Use the scroll bars on the right and the bottom of the list to assist with viewing the whole list. Frequently asked questions can be viewed by clicking on the FAQ link at the top right of the screen. To provide feedback on the resource library, click on Feedback at the top right of the screen. How to add the library link to your favorites. You do not have to log into myHEALTHPlan to view this page. For easy access, add it to your Favorites menu. This is an example of how to add the web page to your favorites using an internet browser such as Internet Explorer. Click on the favorites in the menu at the top of your web page. Click on Add to Favorites. You may change the name to myHEALTHPlan Resources and click Add. In the future, you'll then be able to open up your web browser, click on your favorites, and you will find myHEALTHPlan Resources in your Favorites menu on the left-hand side.